Let's talk about the consequences of obesity. So what are the complications that occur? I'll go through systems. First, let's go to psychological or psychiatric complications. So any obese person generally has self-esteem, and people have a bad eye about them, and they are isolated. And whenever you are isolated, you tend to develop depression. So reduce self-esteem, leading to isolation, leading to depression. Neurological complication might be increased risk of IIH, idiopathic intracranial hypertension, and sometimes may lead to stroke because obesity is associated with hypertension, and hypertension may lead to stroke. So let's come to the cardiac complications. So in cardiac complications, obesity associated with hypertension and hyperlipidemia. And those two conditions can damage the vessels by endothelial injury and by doing chronic inflammation. And those two processes, endothelial injury and inflammation, leads to formation of atheroma and atherosclerotic vascular diseases such as MI, such as ischemic heart disease, such as peripheral vascular disease in the cardiovascular system. In the respiratory system, obesity is associated with obstructive sleep apnea, which is classically presenting with snoring at night. And in GI system, it can lead to development of gallstones, gastroesophageal reflux or acid reflux. Even it can lead to colon cancer development. In the hepatobiliary system, in the liver, it can lead to NAFLD, non-alcoholic fatty liver disease, which progress to NASH, non-alcoholic steatohepatitis, and ultimately develops into liver cirrhosis. In the endocrine system, classically, obesity causes insulin resistance, which leads to impaired fasting glucose or impaired glucose tolerance, which leads to diabetes mellitus. And in female, obesity can be associated with polycystic ovarian syndrome, which is usually a cause of amenorrhea or menstrual irregularity and infertility. And there can be development of some hormone-related cancer, especially in women, such as breast cancer, such as endometrial cancer, and men, prostate cancer. Musculoskeletal complications may include increased incidence of sprain because you have a heavy mass, osteoarthritis because you have heavy load on the joints, and low back pain. So those are the classic complications of obesity: psychological, neurological, cardiac, pulmonary, GI, hepatobiliary, endocrine, and musculoskeletal complications.